Stop scrolling. Are you tired of stubborn acne, dark spots that won't fade, and oily skin that ruins your confidence? You might be making simple skincare mistakes every day without realizing it. I am dermatologist Dr. Sandra Lee, explaining what you must stop doing today. Hit the subscribe button. One of the most common reasons people struggle with persistent acne, excess oil, and dark spots is not genetics or bad luck, but daily skincare habits that unintentionally damage the skin barrier. As a dermatologist, I often see patients who are using dozens of products, expensive serums, and trending treatments, yet their skin continues to worsen. The truth is that healthy skin depends on balance, consistency, and understanding how the skin actually works. The outermost layer of your skin, called the stratum corneum, acts as a protective barrier that regulates moisture and protects against bacteria, pollution, and irritation. When this barrier becomes damaged due to improper skincare practices, it can trigger inflammation, clogged pores, increased oil production, and hyperpigmentation. Many of the mistakes people make every day directly affect this barrier and create the perfect environment for acne breakouts, dark spots, and oily skin. The first major mistake is overwashing your face. Many people believe that if their skin is oily or acne-prone, they need to wash it multiple times a day to remove oil and bacteria. However, washing your face too frequently strips away natural lipids that protect the skin. When these protective oils are removed excessively, the skin reacts by producing even more sebum to compensate. Sebum is the oily substance produced by sebaceous glands, and while it plays an important role in protecting the skin, excessive production can clog pores and lead to acne. Research in dermatology shows that washing the face twice daily with a gentle cleanser is usually sufficient for most skin types. Over-cleansing, especially with harsh soaps or foaming cleansers that contain strong surfactants, disrupts the skin's natural microbiome and increases inflammation. This inflammation can trigger breakouts and worsen existing acne lesions. In many patients I treat, simply reducing the number of times they wash their face and switching to a mild cleanser significantly improves oil control and reduces irritation. Another common mistake is skipping sunscreen. Many people think sunscreen is only necessary when spending time outdoors at the beach or during summer, but ultraviolet radiation affects the skin every day. Even on cloudy days, UVA rays penetrate the atmosphere and reach the skin. These rays stimulate melanocytes, the cells responsible for producing pigment. When the skin becomes inflamed due to acne or irritation, melanocytes become even more active and produce excess melanin, which leads to dark spots known as post-inflammatory hyperpigmentation. Without sunscreen, these spots become darker and last much longer. Studies show that daily use of broad-spectrum sunscreen with at least SPF 30 significantly reduces the development of hyperpigmentation and protects the skin from collagen breakdown. Many people with oily or acne-prone skin avoid sunscreen because they worry it will clog pores or make their skin greasy. However, modern dermatological formulations include lightweight, non-comedogenic sunscreens designed specifically for oily skin types. These products protect the skin without contributing to breakouts. The third mistake is using too many active ingredients at the same time. Social media trends often promote complex skincare routines that include multiple acids, retinoids, exfoliants, and serums layered together. While each of these ingredients can be beneficial individually, combining too many actives can overwhelm the skin. Ingredients like salicylic acid, glycolic acid, lactic acid, benzoyl peroxide, and retinoids all work by increasing cell turnover or reducing oil production. However, when used excessively or layered incorrectly, they can damage the skin barrier, causing redness, peeling, dryness, and increased sensitivity. When the skin becomes irritated, it produces inflammatory signals that trigger acne flare-ups and stimulate pigment production. This can lead to dark spots and uneven skin tone. Dermatological guidelines emphasize introducing active ingredients slowly and using them strategically rather than simultaneously. For example, salicylic acid is effective for oily and acne-prone skin because it penetrates oil and unclogs pores, while retinoids help normalize skin cell turnover and reduce acne formation. However, these should be used carefully and not overlayered without professional guidance. Another mistake that contributes to acne and dark spots is picking or squeezing pimples. It can be extremely tempting to pop a pimple, especially when it appears suddenly before an important event. However, manipulating acne lesions can push bacteria, oil, and debris deeper into the skin. This increases inflammation and damages surrounding tissue. When the skin heals after this trauma, it often produces excess melanin, resulting in dark marks that can persist for months. Dermatological research consistently shows that post-inflammatory hyperpigmentation is more likely to occur when acne lesions are physically manipulated. Additionally, squeezing pimples can cause scarring, which is much more difficult to treat than acne itself. Dermatologists sometimes perform controlled extractions in clinical settings using sterile tools and techniques, but attempting to do this at home increases the risk of infection and skin damage. Allowing acne lesions to heal naturally while using appropriate treatments is the safest approach for preventing long-term marks. Using the wrong moisturizer is another major factor that worsens oily skin and acne. Many people with oily or acne-prone skin avoid moisturizers altogether because they believe moisturizers make the skin more oily. In reality, skipping moisturizer can actually increase oil production. When the skin lacks hydration, it sends signals to sebaceous glands to produce more oil to compensate for the dryness. This creates a cycle where the skin becomes both dehydrated and excessively oily at the same time. Proper hydration helps maintain the skin barrier and regulate oil production. Dermatologists often recommend lightweight, oil-free, non-comedogenic moisturizers that contain ingredients such as hyaluronic acid, glycerin, or ceramides. These ingredients attract water to the skin and strengthen the barrier without clogging pores. Maintaining hydration is essential for healthy skin function and can significantly improve the appearance of acne-prone skin. Another overlooked factor in acne and oily skin is inconsistent skincare routines. Many people start using products enthusiastically, but stop after a few days, or switch to different products before giving their skin time to adjust. Skin cell turnover takes approximately 28 days in young adults and can take longer as we age. This means most skincare treatments require several weeks before visible improvements appear. Constantly changing products prevents the skin from adapting and makes it difficult to determine what is actually working. Consistency is one of the most important principles in dermatology. A simple routine that includes a gentle cleanser, targeted treatment, moisturizer, and sunscreen used consistently over time is often far more effective than complicated routines filled with constantly changing products. Diet and lifestyle also influence skin health more than many people realize. High glycemic diets that include large amounts of refined sugars and processed carbohydrates can increase insulin levels in the body. Elevated insulin stimulates hormones that increase sebum production and inflammation in the skin. Several studies have shown an association between high glycemic diets and increased acne severity. Dairy products, particularly skim milk, have also been linked to acne in some individuals due to hormonal components that may stimulate oil glands. While diet alone does not cause acne, it can influence its severity in susceptible individuals. Maintaining a balanced diet rich in whole foods, fruits, vegetables, lean proteins, and healthy fats supports overall skin health. Sleep and stress are additional factors that impact acne and skin pigmentation. Chronic stress increases levels of cortisol, a hormone that stimulates sebaceous glands and promotes inflammation. This can lead to increased oil production and acne breakouts. Stress also slows wound healing, meaning acne lesions take longer to resolve and are more likely to leave behind dark spots. Adequate sleep supports hormonal balance and allows the skin to repair itself overnight. During sleep, the body increases blood flow to the skin and produces collagen, which helps maintain skin structure and repair damage. Another frequent mistake is using physical scrubs too aggressively. Many people believe scrubbing the skin vigorously will remove blackheads, whiteheads, and dark spots. However, harsh scrubs containing large abrasive particles can create microscopic tears in the skin. These tiny injuries trigger inflammation and may worsen acne rather than improve it. Dermatologists often recommend chemical exfoliants such as salicylic acid or gentle alpha-hydroxy acids instead of harsh mechanical scrubs. These ingredients dissolve the bonds between dead skin cells and allow them to shed naturally without damaging the skin barrier. Environmental factors also play an important role in oily skin and acne development. Pollution particles in the air can settle on the skin and contribute to clogged pores and oxidative stress. Oxidative stress occurs when unstable molecules known as free radicals damage skin cells. This process accelerates inflammation, pigment formation, and premature aging. Antioxidant ingredients such as vitamin C help neutralize free radicals and protect the skin from environmental damage. When combined with sunscreen, antioxidants provide an additional layer of protection against pollution and ultraviolet radiation. Understanding the science behind acne helps explain why these skincare mistakes have such a significant impact. Acne develops when hair follicles become clogged with excess sebum and dead skin cells. This environment allows bacteria known as Cutibacterium acnes to multiply within the follicle. The immune system responds by triggering inflammation, leading to red, swollen pimples. When inflammation damages surrounding tissue, melanocytes produce excess pigment as part of the healing response. This is why dark spots often appear after acne lesions heal. Treating acne and preventing dark spots requires a balanced approach that targets oil production, inflammation, bacterial growth, and skin barrier health simultaneously. Dermatologists often recommend ingredients such as salicylic acid to unclog pores, benzoyl peroxide to reduce acne-causing bacteria, retinoids to normalize skin cell turnover, and niacinamide to calm inflammation and regulate oil production. These ingredients are supported by extensive clinical research and remain some of the most effective treatments for acne-prone skin. The key to healthier skin is not using more products, but using the right products correctly and consistently. A simple routine based on gentle cleansing, targeted treatment, hydration, and daily sun protection can dramatically improve acne, reduce oily skin, and prevent dark spots over time. Many patients are surprised to learn that simplifying their routine often produces better results than complicated multi-step regimens. Healthy skin is the result of understanding your skin's needs and respecting its natural protective barrier. When you avoid common skincare mistakes and focus on evidence-based practices, your skin gradually becomes more balanced, less oily, and more resilient against breakouts and pigmentation. Acne and dark spots can be frustrating, but with the right approach and patience, significant improvement is possible. Dermatology research continues to evolve, but the fundamentals remain the same. Protect the skin barrier, control inflammation, use proven ingredients, and stay consistent with your routine. Over time, these simple principles can transform not only the health of your skin, but also your confidence.